Hi guys, hi friends, welcome to A Whole Vibe. Thank you so much for your subscriptions. Thank you, I appreciate them. If you haven't subscribed, please go ahead and subscribe. Hit the subscription button, show me some love. Don't forget to hit the notification bell so that you're notified every time I post a video. So make sure you find that notification bell and click on it. Thank you so much. Thank you. Like I said, if you haven't subscribed, go ahead and subscribe. Because here at A Whole Vibe, we're all about embracing, celebrating, and appreciating Africa and Africans through interviews and reviews. So you don't want to miss that train. Go ahead and subscribe. Marato always. Hi guys, welcome yet for another exclusive interview. Now today I chat with an amazing person. She is a powerhouse. You know, she's a wealth of knowledge. She is well traveled and been to 33 different countries and 42 cities around the world. So you know she's a powerhouse. She recently got married, so she's married, and she is currently expecting, so she's a mother to be, and she's a fashionpreneur, and she's predominantly a doctor. Now, ladies and gentlemen, I give you Dr. Kelly Champane.
Hello, everybody. Hi, Josh.
How are you?
Good, thank you.
Thank you for agreeing to do this interview.
No problem at all.
And before we start, let me just congratulate you on tying the knot in the pregnancy.
Thank you very much. I appreciate it.
Yeah. So let's start. Let's get straight into it. Now, you went and studied in Australia. Why Australia?
First of all, that was about 12 years ago. Yeah. Around that time, we had the Botswana government offering scholarships for medical students to study abroad. Yeah. So we were doing pre-med, and then we had an option of either going to Australia or South Africa or the Caribbean islands. It wasn't really an option. It was either one of those. So you didn't have a choice of where you wanted to go. Yeah. But you had to sit a few interviews to qualify for some of them, including Australia. And by God's grace, I got picked to be one of the few people who went to Australia. So that's how I ended up there.
Amazing. Yes. Amazing.
Yeah.
You know, so you were destined for this.
I was definitely destined for Australia. Yeah. I always knew. Every time I was there, I was like, this is my home. I can feel it.
So Dr. Kelly, having lived and studied in Australia, yeah. How was that? How was Australia for you?
It was fun. I will always love Australia. It's probably one of the best places in the world. I absolutely enjoyed it. I learned a lot. I grew a lot in every particular way possible, professionally, personally, mentally, and otherwise. Australia is a very multicultural country, so you find that you make friends from all corners of the world. You know, Indians, Asians, black, white. So you learn to interact with so many different cultures, and you learn to interact with so many different types of people. So it really opens your mind a lot. And they're quite good in, you know, balancing the work-life balance when it comes to, especially in our profession in medicine. It's so easy to get trapped in the whole, I have to study all the time. But Australia encouraged a really healthy social life.
That's amazing.
Yeah, exactly. So
doctors don't get that.
No, they don't. So they used to the point where the school used to actually have like organized parties for medical students every week. Like they'll have like a certain party at a certain place or a certain club, and you're all kind of like forced to go. So you can just sort of relax your mind. Yeah. So it's huge on that. So it really helped me appreciate the importance of a work-life balance. So
that's amazing. Yeah. Guys, you should go to Australia. Like, you have to go there. So now you chose to specialize in family medicine.
Yes.
Why family medicine?
It's very personal. Like being a family medicine doctor makes you a holistic doctor. in that you tend to manage patients, not only the biological side of things, not only when a patient comes in and you manage the sickness, you get to manage them from every scope of their life, from that social, from the psychological aspect. So you tend to know everything about them and everything that makes a human being who they are. And I really enjoyed that. I found that when I was in the hospital system, we get a patient with a condition, then we'll manage them and then they're gone. But then you never really get to know the person.
Yeah.
And I've always felt a void with that. But then with family medicine, you become a family doctor and you know everything about that person. You know where they come from, what they ate yesterday, that dog's name, the parents, you know
the children, everything.
the children, you know everybody, you know the whole family. So you become like very close and attached to them, and you get to manage people from every scope, because at the end of the day, managing a condition is not just the physical aspect of it. It has a lot to do with everything else that a person comes with, you know, the social aspect, the financial situation, and all of this. So I really enjoyed that. So I really just enjoyed the holistic approach.
That is amazing.
Yeah.
It's amazing that you get to do things that you love, you know, following your passion as a doctor.
Absolutely.
And also being involved as well.
Absolutely, yes.
So now you've traveled extensively around the world, you know, 33 countries. Amazing. So you really feel like traveling is important. Why so?
Absolutely. So I think I developed a passion for traveling when I was I believe I was in Form 3.
Mm-hmm.
It was, my mom went to school to Cape Town to do her master's. And around that time, I went to visit her for the first time during my Form 3 holidays. It was the first time that I've ever been in a country where I saw so many white people. We're in Cape Town and I saw so many like fun development stuff as the beach. I was just so intrigued about what's out there in the world, and I was like, oh my god. It really opened my mind a lot. And then it inspired me anyway to just want to do more. So that's when the passion for traveling started. And then when I finished medical school, I told myself that the first 2 to 3 years of my post-graduation after school, I'm going to fully dedicate it to just traveling. I was like, I don't want kids, I don't want to get married, I don't want a house, I don't want anything. I'm just going to splurge all my salary on traveling. And I did. Every time I got paid, I booked a holiday. So I was always broke for those 2 years.
And it was worth it.
It was worth it. I enjoyed it.
Yeah.
So I enjoyed it. And that's when obviously the solo traveling came from. The solo traveling came from mainly that, you know, you don't always have somebody to travel with all the time. And I was like, I'm not going to put my life on hold just because there's no one to travel with. So I was like, you know what, I'm just going to pack up my bags and go. I will meet friends where I go. And indeed, I met so many amazing people along the way.
Oh, that's amazing.
Yeah.
Amazing. You gained the family.
Oh, yes, 100%. Yes.
So, having traveled a lot, you've been exposed to different cultures and to different environments. So, what are some of the lessons you learned from that?
Oh, I would say, I mean, all cultures have different types of foods.
Yeah.
So I really had to, I enjoyed trying different cuisines. So I could eat anything right now and I'll still enjoy it. It's so funny because I went to Bali with my now husband, who was my then boyfriend, about 2 years ago. And I was just like trying to make him try all these like Asian fusion cuisines. And he was just like, nah, that's disgusting. He ate pizza and burgers the whole time. Who goes to Asia and eats pizza and burgers? Exactly. I was like, that's so boring. And so I was just like trying different things. But one of the main things is just food. You just learn to appreciate different cultures' food. You learn to appreciate the way people do different, like they live their lifestyle. You know, one of the things that was so interesting was when I was in Cambodia. We went to this village. It's called the Forgotten Village. The people live along the river side. They don't have any internet. They don't have electricity. They don't have any form of technology. And it's just like thousands of people just living around that area. Those people look so happy. Like they just grow up there. The men usually go farming and fishing, and the women normally do the chores at home. The kids don't even get a formal education. They just learn the home chores. But they were just so happy, free-spirited. They didn't have a lot of conditions. They didn't suffer from a lot of mental health. Of course, because they're not exposed to things we're exposed to now.
Yeah,
the social medias, the pressures, and everything.
Expectations.
Expectations. Like, I gotta achieve this. Like, no, they don't have that.
Amazing.
They just have so much just happiness. So you learn a lot about different cultures. So you learn to appreciate different people.
Yeah.
And also it makes you really open-minded. So that's one of the things that I'm really grateful for. And that's how, and it helps a lot, especially in my profession as a family doctor, because I can get anybody. I can get a patient who's a drug addict, the patient who's suffering from depression, any type of thing, a patient who's got HIV, anything, and you'll never feel judged in my room. Like it just makes you so open-minded to accept people from all corners of the world. So that's definitely some of the few things that I've enjoyed.
Yeah. So now, like, you've done a lot of solo travels, so that means you're very appreciative of solo traveling.
Absolutely.
Why so?
You learn a lot about yourself, like 100%. I feel like a lot of my major life decisions came from when I was solo traveling.
Amazing.
Yeah, a lot of like being alone, no friends, no family around you, no influence, and I'll just like make decisions. Okay, this is what I'm going to do this year, this is what I'm going to do in my life in the next 5 years, 10 years, etc. And everything I've set my life goal towards, I've managed to achieve. And a lot of it came from that clarity of just being alone in that space. It teaches you to survive as well. Like, you learn to really survive. I was telling my partner the other day that there was a time I was not stuck, but I had traveled around the UK, and then I had used so much money, much more money than I had thought, and I had $40 left in my account and have like a week left until I went back to Australia. And the hotel wasn't paid for yet, and I had to pay like $300. I had to find food, and I was just there sitting in my car with $40, thinking, what the hell? How am I gonna get out of this? But I just needed to survive. But we managed through.
You survived.
I survived. I survived, but luckily I was getting paid within a day or two, so that kind of helped. Yeah, but you really learn to appreciate a lot about yourself and know who you are. Like, there's not a single thing I feel like somebody can come to and say about me that I don't already know about myself. So it helps a lot, because then if people come say things about you and you know it's not something that's relevant or it's not true, you learn to just filter it away.
Amazing.
Yeah.
So now, after completing your studies in Australia, did you now work in Australia?
I did. I worked in Australia for 6 years before I came back to Botswana.
Oh,
yes.
I thought the entire time you were studying, honestly.
Oh, I was working studying the last 6 years, because part of specialty training is you study and work. Yeah.
So now, when then did you decide to come back home? Was it always the plan?
Yes. It was definitely always a plan. It was a 10-year plan.
Okay.
I left home when I was 20, and I said, when I'm 30, I'm coming back to Botswana. And so I gave myself 10 years to smash out as many goals as I can and achieve as much as I can, and then come to Botswana. So it was definitely always part of the dream, because I always wanted to come home. I always wanted to give back home, at home. And I'm very passionate about community work and leadership. So I knew this is where I wanted to do all of those.
Yeah.
But of course, then a lot of things were sped up by the fact that my partner was here as well. Yeah, so that kind of just be like, okay, I've done what I wanted to do. I think it's time to now settle down and have babies.
I think you've traveled.
I've traveled, I've done it all.
Yeah, and it's amazing because not everybody, I don't want to say myself, I feel like I always come back home, I'm just like you.
Yes.
But not everybody who goes outside wants to come back.
Of course.
After the exposure, after the different cultures. So it's amazing how you were like, no, I'm going back home.
Exactly.
It's amazing.
Yeah.
Now, you're passionate about bringing your expertise to Botswana.
Yes.
Why?
I mean, I love medicine. I feel like this is definitely my area for life, and of course leadership as well.
Yeah.
So I knew that there was, the thing with being in places like Australia is that a lot of people who have the same sort of expertise as you.
Yeah.
And so the community is already fully fleshed with a lot of professionals and doctors and who do a lot of amazing things. Botswana, there are a lot of other people as well, but not as much as there would be in other countries, of course. So I thought there was a bit of a gap here and there, not in every place, but a gap here and there that the community could benefit from expertise, especially specialist services in Botswana.
Yeah, definitely. We are grateful. We are grateful you decided to grace us with your presence.
That's good.
So now you opened your own medical center.
Yes.
Now, tell me,
Yeah.
how was that experience? Did you have any doubts?
I'm a go-getter.
Yeah, you are.
So, I mean, with everything in life, when you start something, you always think, is it gonna work?
Yeah.
So yes, it did cross my mind, is it gonna work? But I thought to myself, what's the worst that could happen? The worst that could happen is I could go into it wouldn't work out. Okay, fine, I'll close the doors and go find a job. And I'll still be okay and content with myself. I wouldn't feel like I'm a failure or anything. I would actually appreciate myself for trying. Giving
it a try.
I just had to think of what's the worst. Every time I do something, I think about what's the worst that could happen. And if it's not death, then I go for it.
You go for it,
Exactly.
and that's an interesting perspective to life. Go for things.
Yes.
If they don't kill you, go for them.
Exactly.
You never know. It might be your breakthrough. It might be the most fulfilling thing.
Yes.
Yeah.
100%.
So you call your medical center premium medical center. So
Yes.
why premium medical center?
That's because of the services we provide. We provide absolute premier services from the moment you walk into our reception, to the moment you see all our staff, to the doctor. Premium in terms of, we're very big on the customer service. We're very big on quality of care as well. So we're very thorough with everything that we do. And we are very big on the aesthetics as well, of everything and the comfort of you being in our space, We want you to feel comfortable, we want you to feel home. So that is pretty much, I guess, a summary of it.
And it makes a lot of sense. I mean, I wasn't waiting for you in the reception area. I was home. And it's stunning. It's stunning. This place is stunning.
Thank you very much.
You've done very well.
Yes.
So, what services do you offer in your medical center?
We've got quite a few actually, and we've been slowly building up, which is very great, which I'm super grateful for. So we've only opened 3 months ago. Initially when we started with myself as a family medicine physician, offering a lot of family medicine stuff, or medical care and general practice stuff. Then we offer sort of medical laboratories, so we do bloods here, we do COVID testing, and we do obviously sort of rapid and PCR testing as well. And we do, we've also got a clinical psychologist who's here full time, so for management of depression, anxiety, or other mental health conditions. We've got a dietitian, so they're here 3 days of the week. We've got ultrasound services. We've got a dentist coming up studying next week. We've got a physiotherapist as well. We've got a pharmacy being set up at the back end as well.
Wow.
Yeah.
So it's a one-way stop.
One-way stop. We want you to come in, feel comfortable at reception, meet our healthcare and our nurse, who will just do your vitals and do all the very first initial checkups. See our doctor. If there's any prescription, you just pick it up from the pharmacy and you go home. If you need to be referred to a psychologist, you've got that here. If you need to refer to a physiotherapist or a dentist or a dietitian, you've got them here.
It's amazing.
Yeah.
It's amazing. I want to come here all the time because it's a one-way stop. I don't have to go to so many places. Yeah. So, Dr. Kelly, you are not the usual doctor. You're not your usual doctor. You're very stylish. So, I want to know this stylish side of you. Has it always been a part of your life, or did you gain this having been abroad?
Yeah. I mean, honestly, it's always been a part of my life. My mom says, I lost my dad when I was 3 years old, unfortunately, but my mom said my dad used to love fashion. So apparently I took that from him. Exactly. So I've always been like that. And obviously having lived overseas also kind of helped a little bit. It's full on, but it could be more. Just that I'm so busy. I'm only either studying or working, etc. But otherwise, I've always loved fashion. Yeah.
And we can see it. I mean, when you go to her page, you will see her. She's always dressed amazing fashion pieces. And you're speaking of fashion, you have your own fashion boutique.
Yes, we do. So we've got a premium beauty parlor as well, which initially, when it started, the initial plan is to make it a boutique and a spa, which got all the equipment ready. But when we just about to open the spa, because we got the place here, we were gonna use the whole space for a little bit of everything, including one of the rooms and one of the back spaces for the spa.
Yeah.
But then we've got a lot of doctors and a lot of doctors, health professionals requesting to come and join us.
Oh.
So we ended up changing our plan of having a spa and then just putting in health professionals instead. So then now we're gonna look for a place separately to set up our spa. But we've just got the boutique running at the moment. Yeah.
It's amazing. Spa, boutique. That's amazing.
Thank you.
That's amazing. You've done very well.
Thank you. I'm just about to add another thing as well.
Amazing. Wow. Way to blow our mind away.
Exactly. I was just laughing with my partner because UB has just appointed me as a lecturer for family medicine from next week. So I was just like, it's crazy that I'll be also walking the corridors with my 8 months belly. I'm your lecturer for today.
That's amazing. That's amazing. Congratulations.
Thank you so much.
You're doing really well.
Thank you.
So now, as a product of studying abroad, I guess you are big on government sponsorship.
Yes.
So why do you believe government should continue sponsoring students abroad?
At us, we've managed to, if we hadn't been the government of Botswana, there was no way that we could have achieved as much as we did, qualification-wise, professionally, mentally, otherwise, to be able to give back to Botswana.
Definitely.
Because obviously our parents could afford that kind of amount of money to send us to medical schools, etc. So it's a huge investment, which I feel the government will definitely benefit from. And nowadays you're getting a lot more other people specializing in a lot of different fields as well, a lot of Botswana in a lot of areas, so which is really helping a lot, because at the end of the day, having your own type, person helping your own it's a lot more.
It's a lot more. We hear each other.
Exactly.
I get you.
Exactly.
Amazing.
Yeah.
Definitely.
Exactly.
So now, Dr. Kelly, just outside of the professional walls and everything, what do you do for fun?
I used to be more fun than I am right now, but I blame it on the pregnancy.
I have to blame it on pregnancy.
I just have to. I just have to. But I love going out. I love going out for coffees. I love brunching. Going out for brunches. I love the gym. I probably was going to the gym pretty much every day for the first 4 to 5 months of my pregnancy. I only just stopped in the last couple of months because it was just getting a bit hectic.
Yeah.
But otherwise, I love gym. I love going out. I love just having a full life.
Yeah, being in touch with the fun side as well as the professional side.
Exactly, as the professional side. So catching up with friends, obviously traveling, and and then just I always tell my partner we need to do something all the time. So he's just used to it. So he's like, okay, what are we doing this week?
Like you already know.
You already know.
She already wants something.
Exactly.
So now, Dr. Kelly, where do you see yourself in the next 5 years?
5 years, let's see. I'll probably be specially elected Minister of Health.
Definitely. I see you there.
Okay. But yes. I aspire to go to politics and leadership. I've always wanted to. But otherwise, practice-wise, I honestly hope to see our practice grow. The plan is not just to have one practice, it's to have multiple practices. So hopefully that will keep the vision will keep going.
Around Botswana?
Around Botswana, yes, around Botswana. So the vision will keep growing. And it's quite interesting because I'm clinical based, which is like in the clinical and the business side of things. I'm also academic based, that's why I'm doing the lecturing role.
Yeah.
So I also have passion of going up to professorship level. So I have no idea how I'm gonna balance out my life. But
you have a very busy life.
Very, very busy life. So in the next 5 years, to be honest, I'll be grateful if I could see the practice growing. I would be grateful to either be at a senior lecturer or an associate professor level at the university. and next elections be the Minister of Health. I wouldn't be surprised.
I wouldn't. At the rate you're going, you
Yeah.
know what? You might even be the president. I mean,
I know that's a 10-year plan now. I thought that
oh yeah,
it's a 10-year plan.
amazing, amazing. So, what would you say to a Motswana who wants to study abroad?
Yes, I mean, I would say go for it if you know, go for it. I understand the biggest barrier at home, to be honest, is finances.
Yeah.
And having been home, and I've learned to appreciate that the most than I did while I was abroad. Because sometimes you take this for granted, but as soon as you're on the ground, you're like, wow, it's hard. So the biggest barrier for our people, obviously, is finances, being able to afford to actually go abroad. So if the opportunities come, I'll say go for it. There are lots of opportunities for actually getting abroad through scholarships, either through, obviously we've got the High Achiever Scholarship, but there are also lots of other scholarships out there. You just need to go headhunt them.
Yeah.
You know,
Google them.
Google them. There's a Road Scholarship, there's a Shipping Scholarship. Obviously these are the popular ones, but there are also a lot of other small other Australian Award scholarships. So there's huge opportunities of going abroad. You just have to look for opportunities
And grab it.
Yeah,
definitely.
Yes. Yeah.
So, as an entrepreneur, how best can Botswana support you?
Come to the practice.
Definitely.
Yes, please.
Yeah.
So, I mean,
And the boutique, obviously.
and the boutique as well, would love that.
Yeah.
But I really do, I'm so grateful for Botswana. For a practice that's only started in the last 3 months, I would honestly say we're doing very well.
You are.
Yeah, we're doing very well on average with our numbers, with our accountant is quite impressed as well with the rate at which you're going. And so we know that clearly we're doing a good service and we're providing good customer and health care to the patients, which is the most important thing. Premium. Whole package.
Yeah, the whole package.
So Botswana have been very supportive, the community has been very supportive. I'm grateful that, you know, a lot of people in Botswana already kind of knew of what I was doing in Australia before I came. So it really helped because as soon as you open the clinic, people were like, okay, we want to come.
We've been waiting.
Yes, we've been waiting. So it really helped. I feel like had it not been that, it also would have been difficult to just start off right away and just build a name, build a clinic when you just arrived in Botswana and don't know a lot of people.
Yeah.
So that's really helped.
Yeah.
So yeah.
So we are grateful. Thank you so much for guys for supporting her. Thank you, and continue supporting her. So we've come to the end of our interview now. Is there anything you'd like to say?
I don't know. I mean, I have a lot of things I like to say. Honestly.
Yeah, I know. You know, when I was coming to do this interview, I already knew that you are a talker. So I was like, damn, this is gonna be fun.
Exactly. Yeah. I mean, the most important things I like saying is, I guess, don't just go for it. I'm just huge on going for opportunities and just looking for them. No one is gonna come and give you something and knock on your door. You need to be the one who's proactive about everything that you do in life. And just knock on doors, look for opportunities, and if you find anything, even if you're not sure, not confident that you can do it, just go for it. You'll figure it out along the way.
True.
And you'll never know how far you can go. So just definitely go for it.
You heard it, guys. Go for it. If you want something, just go for it.
Yeah.
Dr. Kelly, thank you so much for doing this interview with us and welcoming us in your lovely, lovely, lovely medical center.
Thank you.
It's amazing.
Yeah.
So, guys, we've come to the end of our video. In the description, I have left for you guys links to Dr. Kelly's accounts, her personal accounts as well, Facebook, Instagram, and her, medical facility and her boutique. All of the links are there. Just go and make sure you like her post, make sure you follow her, just to be updated. And let's continue supporting Botswana creatives, Thank you.
Thank you.
For my niggas, I appreciate it. I appreciate it. Ain't no nigga gon' switch faces. That's why the rich places.